Welcome and thank you for standing by. At this time, all participants are in a listen-only mode until the question and answer session of today's conference. At that time, to ask a question, please press star 1 on your touch-tone phone and record your name at the prompt. This call is being recorded. If you have any objections, you may disconnect at this time. And I would now like to turn the call over to Ms. Kim Judy. Ma'am, you may begin.
Hello, and welcome to our webinar on understanding your healthcare options. Today, I want to welcome you to understanding your healthcare options. Typically, we do have our chat feature running throughout the length of our webinar. However, in just a moment, we'll be closing down the chat so that you can make sure that you're paying as close attention to this very important topic. We will have time for question and answers later on in this session. You will need to call in order to ask a question. We will not have the chat feature available or the Q&A feature available as we normally do. So if you'd like to ask a question later, be sure to call into the phone line so that you may do so. I'm your host, Kim Judy, from the VISTA Training Unit. Many of you may recognize me from pre-service orientation if you attended orientation in the Boston or Philadelphia area. Assisting me today are Dan Veal, one of our AmeriCorps VISTA leaders at the Bridging Health and Human Services Project, and Jory Kamosi, the account manager for the AmeriCorps VISTA Healthcare Benefit. Let's review today's agenda. We know that you are all aware of the Affordable Care Act. What you may not know is how to respond to the requirements of the Affordable Care Act or how the benefits of the health care plan you receive as a VISTA fit in. The Affordable Care Act offers more health care choices for consumers. However, the options and level of coverage vary greatly state by state. Individual circumstances like your age and household income also affect your coverage options. We don't want any of you to fall through the cracks because you didn't understand what all your options are. Our goal for this webinar is that despite the complex nature of the subject, you'll know where to go and what to do in order to make an informed decision about the healthcare options that are available to you and be fully aware of the benefit we offer during your year of service. We will present a number of resources during this presentation. Please understand that the list is not a complete list and should not be taken as an endorsement by the VISTA program or the Corporation for National and Community Service. Following the session, we will email you a list of these resources and links so you don't need to write them down during the session. They're also available to you in PDF format under the File section of today's webinar, the first resource listed under Files at the bottom of your screen. We'll also have time for questions and answers. To ask a question, you will need to call into the phone line. We will not be using the chat and Q&A features during this webinar. At this point, we will be turning off the chat feature. Joining me today is VISTA leader Dan Veal. Dan is serving as a VISTA leader with the Community Action Partnership in Washington, D.C. for the first year of the Bridging Health and Human Services Project. The Community Action Partnership represents more than 1,000 agencies who cover 97% of the nation's counties. His project is dedicated to building coalitions and programs to help provide low-income communities with access to health-related resources, information, and quality health care. He and his 8 fellow VISTAs in Arizona, Michigan, New Jersey, and Ohio have been trained as certified application counselors, more commonly referred to as CACs or Navigators for the Affordable Care Act. We appreciate Dan for his time and congratulate the community action agencies who, along with the War on Poverty and VISTA are commemorating 50 years of service to America and the war against poverty. We invited Dan to join us today because he has experience not only as a VISTA leader engaging with the Affordable Care Act, but also has an experience as a VISTA who has successfully navigated the Affordable Care Act and the marketplace. We're excited to have him share his experience with you.
Thank you, Kim, and thank you to everyone who is listening. I'm grateful for this opportunity and hope that what I share today will be useful to you all. I have a quick poll that I'd like to start with today. And the poll is coming up right now. You can find the poll on the right side of your screen. Please indicate your choice by clicking the button next to the statement which matches your situation best. Your response will be automatically registered. The question, do I know how to determine which healthcare choices are best for me? 1, I know what my options are and what I need to do. 2, I know some of my options or some of the things that I need to do. 3, I am confused or need more information. 4, do I need to make healthcare choices? All right, it looks like most everyone is finishing up, and I'll reveal the results here in a moment. All right, it looks like the good majority of us could use some more information. Quite a few people are confused or need some more information, and there are plenty of people who know some of the options and some of the things that they need to do. I'll start with some of the basics on the ACA and then move quickly on to how the ACA affects all of us as VISTAs. The changes due to the law are extensive and affect everyone in some way or another. This law has fundamentally changed healthcare. Major pieces of the law have been and will continue to be implemented every year from 2010 through to 2020. Among many other things, the ACA was designed to bring about a more apples-to-apples comparison of health insurance plans. Consequently, the ACA affected all previously available and/or negotiated plans in different ways. Health insurance plans had to change very little in some cases, and in others, the plans had to change a lot. Consistency throughout the U.S. required in some cases changes to state-based laws, changes from health insurance providers, changes to what employers had chosen to offer their employees, etc. It also led to transition-based issues with previously negotiated health insurance contracts. State decisions on Medicaid expansion disrupted some major pieces of ACA implementation as well. These fundamental changes in healthcare have made the rollout and implementation of the ACA very complex, and many of us have had to figure out the best way to navigate the law and the options available to us. How does the ACA affect all of us as VISTAs? Well, in a lot of ways. But each one of us have to make a decision. Depending on your individual situation, the decision we make may be a different one than the decision the VISTA next door will make. I will explain step by step many of the decisions VISTAs may need to make and try to give you the needed material to make an informed decision. There will be a lot of details, and some of the details will speak to people in very different situations than your own. So instead of listening and also trying to take a lot of notes really fast, please just listen. VISTA will send out all the slides of this presentation, and you will be able to grab the most important details for your situation. The decision process, step 1. You will need to determine if you are already covered by what is called a minimal essential coverage rated health insurance plan. For the rest of this webinar, we'll use the word or term compliant instead of the more formal minimum essential coverage term. So if you already have a compliant plan from an agent or broker, or if you already have a plan from healthcare.gov, no additional steps are required. Know that you may already have a compliant plan if you are under 26 years of age and are covered by your parents' plan, or if you are covered by a spouse's plan. You may have an ACA exemption if you are covered by what is called a grandfathered plan. You will already have a compliant plan if you are already today covered by Medicaid, Medicare, or have TRICARE via the armed services. If you do not know if your plan is compliant, please call your health insurance company and ask them. If you only have the VISTA health coverage from Seven Corners, know that you do not have a compliant health insurance plan. If you fit into this category, or if you have health insurance or coverage from other sources, which is also not compliant and not considered a grandfathered plan, then let's move on to step 2 of the decision process. Oh, one thing to note before moving on to step 2. If you have dependents, you are, of course, responsible for your dependents. The decision process, step 2. At this point, you have 2 options for getting compliant health insurance. The first option is to go to your state's health insurance marketplace by starting at either healthcare.gov or by calling 1-800-318-2596. Your state's health insurance marketplace can be reached through the nationwide portals. To discover your options, you will need to fill out an application. Note, you can fill out an application without having to choose or pay for any particular health insurance plans. You can fill out your application in any one of 4 main ways. First, if choosing the online option, you will want to start at healthcare.gov. If you would rather use the Spanish language version of the website, please instead start at cuidadodesalud.gov. If your state has its own health insurance marketplace website, both healthcare.gov and cuidadodesalud.gov will send you on to those websites. Second, if choosing the phone option, the toll-free number is 1-800-318-2596. There is assistance available in more than 150 languages. Third, if choosing the paper option, you may be able to find a paper application at your local library. Paper applications can also be downloaded from healthcare.gov. Know that there may be a several-week processing lag for paper applications. Fourth, if choosing the in-person assistance option, know that there are state and federal government certified assisters, including Navigators, certified application counselors or CACs, as well as in-person assisters or IPAs. Some states have decided to give these certified assisters different titles. You can find the local in-person assistance person by going to localhelp.healthcare.gov. Alternatively, if you live in a state not expanding Medicaid, or if you want to compare plans, you can shop for and buy a compliant health insurance plan from an agent or broker. They will not, however, be able to offer you the tax credits nor the tax subsidies which are available from healthcare.gov and your state's health insurance marketplace. The decision process, step 3. Once you have completed your application and sent in documentation if necessary, you will be given an affordability assessment. Nearly all VISTAs will end up with one of the following 3 categories. 1, you are deemed eligible for Medicaid. 2, you may now shop for a compliant health insurance plan. Tax credits and tax subsidies may be available. Or 3, you are deemed eligible for an exemption. All of the assessments will be given a detailed multiple-page report. The assessment will tell you which category you fit into, what your options are, and the next steps to take. Know that you may file for an appeal if you disagree with your assessment. If you are deemed eligible for Medicaid or for another state-administered health insurance program, your state may have chosen to require that you fill out an additional application. If you are deemed eligible for an exemption, you can choose to act upon that eligibility. If you choose to shop for a compliant health insurance plan, you should have a number of different health insurance plans to choose from. What you believe is best for you will be highly dependent upon what you want and what you believe you need from a health insurance plan. After doing all of your research, if you believe that the available options do not work for your situation, you may decide to not have a compliant health insurance plan. At that point, you may be assessed a federal income tax penalty, otherwise known as the Individual Responsibility Mandate, in 2015 for your 2014 taxes. The full penalty would cost you the greater of either $95 or 1% of your income. If you make any changes to your health care coverage, know that you will need to update a form with 7 corners called the Other Health Care Coverage Questionnaire. Jory will tell you more about this step during her presentation. If you have never bought a health insurance plan, the process may feel a bit overwhelming. There are a lot of new terms and options to learn about, as well as personal decisions to make before you choose and pay for your new plan. It will likely take some time to figure out which plans may fit your wants and needs better than other plans. So before making decisions, you may want to take some time to study your options. This slide and the next couple of slides will give you information on some available resources. The official resources for the ACA and the health insurance marketplaces can be found on the link on your screen or through healthcare.gov. You can find a glossary of terms, an application checklist, a number of brochures, fact sheets, and articles, as well as paper applications and eligibility appeals forms. As a reminder, these are resources that I have personally found helpful. This list is not comprehensive, and it is not indicative of an endorsement by the AmeriCorps VISTA program, the Corporation for National and Community Service, nor the Community Action Partnership. Also, VISTA will send out slides of this presentation, so you don't need to write these down. If you want to get a quick estimate of what your monthly health insurance premium would cost, check out both of the calculators listed on the screen. Both of the calculators have pros and cons, but if looked at together, the Kaiser Family Foundation calculator and the Get Covered America calculator should give you a pretty decent idea of what your options will be. The list of available resources could go on and on. This slide shows 6 reputable, nonpartisan organizations which have a lot of great resources for consumers. There are also people and organizations that are certified to help you, including Navigators, CACs, and IPAs. Some states have decided to give these certified assisters different titles. Regardless of title, you can find the local in-person assistance help by going to localhelp.healthcare.gov. Since we are all VISTAs, I want you to hear what it was like for me to sign up for a healthcare.gov plan. In more than 16 years of work, I've been offered something beyond a catastrophic health insurance plan in just a handful of years. When sick or injured, I've avoided the doctor, and I have the scars to prove it. I just couldn't afford to pay the bills. The ACA has provided a choice and some options. Over the course of October, November, and December, I tried a number of times to access the marketplace. I also called the 800 number on several occasions. Sometimes the person on the phone was great, was helpful, sometimes not. If the person was not helpful, I would find a way to respectfully hang up and call back to get someone else. In January, I started over. Since I had all my information with me and I knew what I was doing, the application took less than 15 minutes. Later that evening, I was able to pick a plan. All of my research, patience, and perseverance paid off. I ended up picking a silver plan. The silver plans gave me the opportunity to use the tax subsidies and the tax credits. After choosing the available tax subsidies and tax credits, my initial monthly premium cost of $240 was reduced to $18. The standard actuarial value of a silver plan is 70%, which more or less means that the plan only covers an estimated 70% of my health care expenses, and I am responsible for the remaining 30%. However, after the tax subsidies and tax credits, my silver plan will cover an estimated 94% of all of my health care expenses. One last informational slide for me today, and then I'll put another poll up. Important dates. In order to not have to face a prorated amount of the federal income tax penalty, you will want to have a compliant plan starting on April 1st. In order to do so, you will need to choose and pay for a plan by March 15th. Since it typically takes a few days for health insurance companies to process their paperwork and send you a bill, you will likely want to make sure that you choose your plan at least a few days before March 15th. Open enrollment is a term for the time period in which you can sign up for a new or different health insurance plan for the upcoming year. A typical open enrollment period for the upcoming year starts in October or November and lasts about a month. The open enrollment period for the 2014 health insurance plans started on October 1st, 2013, and it goes until March 31st, 2014. If you do not have a compliant health insurance plan after March 31st of this year, you will not be able to get a health insurance plan until 2015 unless you have what is called a qualifying life event. A qualifying life event would include something like a new job, a baby, or a move to a new state. November 15th, 2014 is the start of the 2014 open enrollment period for health insurance starting in 2015. All right, here's the poll I promised. You can find the poll on the right side of your screen. Please indicate your choice or choices by clicking on the button next to the statements which match your situation. Your response will be automatically registered. Please respond to the following statement. I plan to, 1, visit healthcare.gov to research my options. 2, use an online calculator to estimate costs of insurance. 3, contact a Navigator, CAC, or IPA for in-person assistance. 4, stick with the coverage I have and do nothing. 5, something else. All right, it looks like most everyone is starting to finish up, and I'll reveal the results shortly. Great. It looks like the good majority of us were able to decide on some action steps. Great. As a reminder, these slides, as well as the upcoming presentations from both Kim and Jory, will be sent out to all of us. Thank you for listening to me, and thank you for inviting me to present, Kim.
Dan, thank you so much for joining us on this webinar. Hearing your experience as a VISTA member with both Seven Corners and your experience on healthcare.gov, I think is extremely beneficial, and we really appreciate you being willing to share that with your fellow VISTAs. Before I turn it over to Jory to share information about your AmeriCorps VISTA healthcare benefit, I want to give everyone some background on the benefit in the context of the Affordable Care Act. As Dan described earlier, the Affordable Care Act, with all of its provisions, is very complex. As a program, what we found most challenging are the differences in how it is administered state by state. In addition to that, there are many personal variables, like your household income, whether or not you have dependents or are claimed as a dependent, that determine how you must respond to the Affordable Care Act. This range of variables deeply affected VISTA as a national program wishing to ensure parity in health coverage for all of our members. We have tried to provide a substantial health benefit available equally to all of our members serving across the country, despite the state-to-state and individual differences. After much analysis and based on all the available information, we decided that the best approach is to continue to provide our benefit through Seven Corners. Our contract with Seven Corners lasts through the end of this fiscal year. Therefore, there will be no changes to your benefit between now and September 30th, 2014. We will give you advance notice on any changes we make after that. We plan to use this coming year as a transition year to see how the Affordable Care Act pans out and continues to be implemented and rolled out across the country. And we will adjust our plans accordingly. With our members' well-being and best interests at heart, and having been designed over the years prior to the Affordable Care Act, we found that the benefit we provide meets the needs of most of our VISTA members during their service term. For many VISTAs, this coverage will function as a free supplemental health coverage policy on top of a fully ACA-compliant plan, and will act as a safety net for those of you who fall into the coverage gap, those of you who are living in a state that isn't expanding Medicaid, among other gaps that exist. We wanted to limit your out-of-pocket expenses. Therefore, cost share is limited to $5 for medical office visits and prescriptions. There's a $0 copay for generics, and there's no cost share for emergency hospitalizations. Further, you do not have to pay a premium to access the plan, and there are no annual or lifetime limits on coverage. That differs greatly from an insurance plan where you may pay a monthly premium simply to use your benefit, and you may hit a limit on the amount of coverage an insurance plan may provide you in a year or over the lifetime of your plan. A need for a catastrophic health care, an example being appendicitis, incurs no cost to you. Again, this is unlike an insurance plan where you would most likely incur deductibles and other out-of-pocket expenses. Finally, you do have access to highly requested services like an annual OBGYN exam, CDC-recommended immunizations, essential screenings, and FDA-approved medications. Jory will go into all of these benefits in more detail in just a minute. Unless you elected to waive our coverage, you automatically began receiving health coverage on day one of your service. There is no waiting period for our benefit. I'm now going to turn it over to Jory Camozzi to provide more details about the benefit and how to access it during your year of service. Jory?
Thank you, Kim. I appreciate the opportunity to talk with VISTAs about the AmeriCorps Health Benefit Plan. This part of the session will help you understand what's covered by the plan and what's not. We'll take a look at the plan network, Seven Corners as the plan administrator, and show you how to access your benefits. The AmeriCorps Health Benefit Plan provides limited health coverage in a way designed to minimize your out-of-pocket expenses. The plan is free for VISTA members. It is individual coverage, meaning dependents are not covered. The plan is self-funded and written by the Corporation for National and Community Service. It is not an insurance plan, nor is it designed to be full major medical coverage. The plan is administered by Seven Corners Incorporated. A provider is a person or organization that provides health care, for example, a doctor, hospital, or pharmacy. This plan is based on a network of preferred providers. The PPO network contains physicians, clinics, hospitals, and pharmacies. For best coverage, use providers in your network. The primary network for most states is Humana Choice Care, and in New York and New Jersey only is PHCS. Your pharmacy network is Catamaran. What's covered? Some routine services we will cover in just a moment, and non-preexisting conditions. Eligible visits to the doctor have a $5 copay. Also, certain lab tests and x-rays are covered. Emergency services with a $25 copay. Hospitalization. Pharmacy, a $0 copay for generic, $5 copay for brand. Prenatal and maternity care, as well as physical therapy, occupational, and speech therapy. A copay is the amount the patient pays to the provider at the time of service. The pharmacy benefit is the only benefit on this list that is not subject to the pre-existing clause, which we'll look at in just a minute. Women have coverage for one GYN health visit per service year, which includes the Pap test, breast exam, and please note, routine lab work is not covered. Examples of routine lab work would be a routine thyroid or cholesterol test. The only lab work for the Pap test is covered. Birth control is covered. One mammogram per service year for women over 40 years of age, and one bone mineral density test for women over 65 years of age. Men have coverage for one prostate examination per service year for men over 50 years of age. This includes the PSA test. PSA stands for prostate-specific antigen. This test measures the blood level of PSA, a protein produced by the prostate gland. The higher a man's PSA level, the more likely he is to have prostate cancer. Immunizations recommended by the CDC are covered. Immunizations for travel outside the U.S. are not covered. Dental treatment for the emergency alleviation of dental pain is covered. Routine dental care is not. For vision, the only coverage is eyeglasses or contacts damaged in the line of duty. This is limited to a $25 reimbursement for the office visit and limited to a $50 reimbursement for repair or replacement of the glasses or contacts. For glasses or contacts damaged in the line of duty, you will have to pay up front and then submit for the maximum reimbursement listed on this slide. In order to receive this reimbursement, you must complete the claim form and attach both the receipt showing payment as well as a letter from your direct supervisor. For more information about emergency dental or the vision benefit for damaged contacts or glasses, please refer to the member guide. For mental health care, 3 outpatient mental health visits per benefit year are covered and not subject to the pre-existing limitation. Additional mental health visits are subject to the pre-existing condition limitation. What this means is if a mental health condition is not pre-existing, you are not limited to only 3 visits. The limit of 3 visits is only for a pre-existing mental health condition. For inpatient mental health care, the plan covers inpatient hospital services for conditions that are not pre-existing. Since this is not insurance, there is a lifetime pre-existing clause. A pre-existing condition is any condition or illness for which medical treatment was given or a diagnosis was made on or before the effective date of the AmeriCorps Health Benefit Plan. Prescriptions related to a pre-existing condition are covered as long as they're not on the excluded medication list. The effective date of your AmeriCorps Health Benefit is the first official date of service. What's not covered? Routine dental care, routine eye exams or glasses and contacts, routine exams, meaning a general physical exam. And for more information, please see the AmeriCorps Member Healthcare Guide. For additional options and resources, please see the low-cost vision, dental, and medical care document located in the Files section, just below the slide on your screen. We'll also post it on the VISTA campus with a recording of this session. Seven Corners administers the AmeriCorps Health Benefit Plan. We have a website, americorps.sevencorners.com, where you'll find current information about the health benefits, a link to the medical provider directory, a link to the pharmacy directory, a list of frequently asked questions, links to various forms, a glossary of terms, and our contact information. Seven Corners has a member portal called My Plan. In My Plan, you can view your claims information, see customer service interactions, which includes a live chat, print your ID card, and review online EOBs or explanation of benefits. AmeriCorps has gone to paperless explanation of benefits. An email notification will be sent to your email address on file each time a claim is processed. You can view the EOBs in your secure My Plan account. Upon activation into the health benefit, you will receive your ID card and welcome packet. This typically happens the first week of VISTA service. Your ID card contains key information such as your ID number, plan contact information, pre-certification requirements, and pharmacy information. You should keep it with you at all times. This ID card should be presented to a physician, hospital, or emergency room. Again, if you lose your card, a printable ID card is available in your My Plan account, or contact Seven Corners for a replacement card. How to use your AmeriCorps Health benefit. Step 1, coordination of benefits. All VISTA members who wish to be covered by the AmeriCorps Health Plan must submit the Other Health Care Coverage questionnaire to indicate whether or not they have other coverage. No claims will be paid unless this form is on file. You can download and complete this file by submitting it in your My Plan account, or download and complete it by faxing to 317-575-2795, or it can be mailed to the Seven Corners physical address or emailed. If you have changes to your health coverage at all, please fill out a new form. An example of this would be if you purchase new coverage on the insurance marketplace or are now covered under another health insurance benefit. This also would be if you are no longer covered under another health benefit, we would need this form filled out. If you have other health coverage, AmeriCorps is secondary to all other insurance. AmeriCorps is only primary to Medicare, Medicaid, and military benefits. Step 2, to find a provider. On the website, you can search for a provider by city, state, or zip code and filter providers by the specialty you are looking for. You are encouraged to use the network. Failure to use the network could result in you being responsible for charges above the usual and customary rate, or UNC for that area. What is UNC? It is the rate that other providers charge for the exact same service with that specific zip code. On the website, you can find a link to the directory to find doctors, pharmacies that provide services in the network. Step 3, make an appointment. In most states, you will ask, do you participate in the Choice Care Network? In New York and New Jersey, you would ask, do you participate in the PHCS or Multi-Plan Network? These are on your ID card. Be prepared to cover the copay. There was a recently added network specific for mental health providers called LifeSync. LifeSync was purchased by Humana, which gave access to AmeriCorps members for mental health. The logo for LifeSync is also on your ID card. LifeSync providers will come up in the online search for mental health providers. You'll recall that the copay is the amount that a patient pays to the provider at the time of service. Let's look at the specific amounts. There is a $5 copay for office visits, a $25 copay for emergency room visits, and if you are admitted to the hospital, the $25 ER copay is waived. Prescription medicines that are covered are not subject to the pre-existing clause. However, there is a list of excluded drug categories. There's a $0 copay for generic medications, a $5 copay for brand medications with a generic equivalent, and a $0 copay for brand medications without a generic equivalent. You can purchase a 30-day supply at a retail pharmacy or receive a 90-day supply through mail order. See the excluded drug categories on page 9 of the AmeriCorps Health Benefit Guide. You must pre-certify an inpatient hospitalization by calling Seven Corners at least 1 business day prior to a planned hospitalization or within 2 business days after being hospitalized for emergency admission. Pre-certification is not a guarantee of payment. It's a way to certify medical necessity. Inpatient hospitalization means staying overnight in the hospital. The pre-certification and review for medical necessity is required. Not only do we want to make sure that you're not hospitalized for longer than necessary, we also want to be sure that a hospital doesn't discharge you if you have a medical need to still be hospitalized. A claim form is needed if you pay out of pocket for medical expenses and are submitting for reimbursement. For prescription reimbursements, please refer to the correct prescription form also on the website. If you pay out of pocket, you can download this form, fill out page 1 of the form, give your provider page 2 to complete, and submit the entire form with receipts to Seven Corners for reimbursement. Manual claims for reimbursement, of course, are still subject to the AmeriCorps Health benefits outlined in the guide. An injury accident details request form is required for all injury claims, no matter how small. If you are injured or become ill through the act or omission of another person, AmeriCorps has the right to seek payment from the other party. AmeriCorps is not responsible for the member's attorney's fees or other costs. The website contains links to the benefit guide, which has a full overview of covered services, provider directories, a link to My Plan, and the various forms and letters that you may need. There are a couple of ways to contact our customer service team. They're friendly and knowledgeable, so don't hesitate to call if you have questions. You can contact us at the number listed here, 24/7. This number is also on your ID card, or email us at AmeriCorps@sevencorners.com. We can help you with questions about your benefits or medical bills. This is the same number to contact for a hospitalization or surgery. Also, please contact this number for treatment of emergency dental pain, to get forms, or if you need assistance finding a doctor or hospital. That concludes the AmeriCorps Health benefit portion of the presentation. I will now turn it back over to Kim.
Dory, thank you for joining us today and giving our VISTA members more information about their benefit and how to access it during their year of service. At this point, we are going to open up the phone lines for questions. To ask a question, you will need to call into the phone line that's listed at the bottom of this slide using the passcode listed. And then to ask a question, you'll need to press *1 and give your full name to the operator.
Thank you. It'll be just a moment while we let those questions queue up. And
to
withdraw your question, press *2.
While we wait for the questions to queue up, I want to let you know who is available to answer your questions. So Dan Veal is still with us, and as a VISTA leader who's intimately aware of the Affordable Care Act, and he and his team of VISTAs are offering information to the community at large. He is here to answer your questions about how best to navigate the Affordable Care Act and specifically the insurance marketplaces. We also have Jory here, who will remain on the line to answer questions about the Seven Corners benefit and how to access it. And then myself, and joining me, Patrick Triano, our Director of Outreach, Training, and Member Support. He and I are here to answer any questions that are outside of Dan and Jory's purview. So with that, operator, we will take our first question.
Okay, thank you. Our first question is from Kelly. Your line is open.
Hi, Kelly.
Hello.
Hi, Kelly. You can go ahead and ask your question.
Okay. I know that some of these questions are going to be too individual, but I'm hoping to make this as broad as possible. I filled out the healthcare.gov application, and I was told I did it through the phone call, and then I was told that I lived in a state that I was deemed eligible for Medicaid, and then never heard anything and don't know, like, once that happens, once we were deemed eligible for Medicaid, then what?
Okay.
Should we be contacting Medicaid, or will someone else contact us, or that's my question.
Kelly, you did a great job of making that question general enough. Essentially, the question is, after I filled out the application with an in-person navigator over the phone, I am told what I'm eligible for, what happens next? And I'm going to turn to Dan and ask him to shed some light on that.
If you are deemed eligible for Medicaid, what happens next depends on your state, unfortunately. For most states, your information will be sent directly to the Medicaid offices. For some of the states, they've made the process a little bit harder, and so you will need to contact your office that administers Medicaid in your state, and in some cases you'll need to fill out another application. But if you print off your healthcare.gov evaluation, the deeming information, and you bring that into your Medicaid office, in most cases that will make the process easier when you do go to your Medicaid office.
Okay, I'm sorry, just follow that up. If I did it on over the phone, I never received an email or anything, any paper, like he's saying that we got some sort of report, and I didn't get any of that. If we don't get those things, should we seek that out somehow?
Yeah, you can certainly seek that out, or if you call the 800 number again and ask them to send you a paper copy, they should be able to do that for you.
Perfect. This has been extremely helpful. Thank you very much for doing this.
Thank you, Kelly. And Dan, just as a follow-up to that, what is the name of the office in most states that might handle Medicaid? Is it typically named the Office for Family and Children's Services? What are some of the names that VISTAs might come across?
You'll end up with a lot of different names, and only a few states are going to be called Medicaid. But if you go to Google and you Google your state and you Google Medicaid office, at that point it should give you the name of your office in your own state.
Great. Thank you. Operator, we are ready for the next question.
Okay, great. Thank you. Our next question comes from Tiffany Showtell. Your line is open.
Hi, Tiffany. You can go ahead and ask your question.
Okay, I think it's me, but the name's not Tiffany.
What is your name then?
Sydney.
Okay. Sorry, I think I heard it wrong. Go ahead and ask your question.
Okay, kind of make my question general as well. If you're originally from and still a resident of one state, that has their own healthcare marketplace, and you're currently doing your this VISTA year in another state with another different marketplace, but you're only planning on staying in one state for just like 1 year. Which state should you be applying for the health care with? Where your residency is or where you're living for the year?
That's a really good question. And generally speaking, you're going to want to apply for health insurance in the state in which you're serving. Most insurance providers are going to offer services within your state, and so your provider network, your doctors and other physicians are going to be in the state you're serving. So you're going to want to get an insurance plan for the state in which you're serving. And if you return home at the end of your service, you'll have a qualifying life event that will make you eligible to reapply for insurance in your original state of residence.
Okay. And I have one more question. A lot of the health insurance forms, applications, ask for income, and at least I've been told at the PSO many times that what we have is a living allowance or stipend, and we should mark it as income for applying for food stamps, but I'm wondering, should we mark it as income also when we're applying for health care coverage, or is it not income again and just a living stipend?
Yep. Another great question. Your living allowance is considered taxable income. That's why we withhold federal taxes from it. And as many of you may know just from listening to news reports, much of the Affordable Care Act is based on your annual household income, the potential individual responsibility payment is also based on your income. So yes, your living allowance is considered taxable income and needs to be reported as such when you're filling out a marketplace insurance application.
Okay, that covers my main two big questions I was struggling with.
Great, thank you for asking. We are ready for our next question.
Thank you, and our next question is from Raina Kirchner. Your line is open.
Thanks. Can you hear me?
Yes, Raina, go ahead.
Excellent. So when filling out my application on the healthcare.gov, it asked me for my income, which was easy enough to answer. But it also asked me who my employer was, and I wasn't sure what to put. And I'm sad to say that the VISTA helpline gave me several different answers or no answer at all.
Okay. I'm glad you asked this question because it's actually on my list of questions that need to be answered even if someone doesn't ask them. So thank you for raising it. We looked into this, and by statute, VISTAs are not considered employees of their sponsoring organization or of the VISTA program and the Corporation for National and Community Service. So when you are asked to list your employment history, you do not list anything for your current employment. And when you are asked if you have employer-based health coverage, again, the answer would be no, because our coverage is not, considered insurance. And it sounds like you already have the answers to how much income you have.
Okay.
Does that clear that up for you? And that is the final answer on that question, and we will be adding that question and answer to the FAQ sheet that is available at vistacampus.gov/healthcare and is also in the file section underneath the slides.
Okay.
All right?
Mm-hmm.
Thanks, Raina.
Thank you.
Thank you. Our next question is from Sarah Campbell. Your line is open.
Hi there. I'm a little confused when you guys say that Seven Corners coverage is secondary to other insurance. What does that really mean?
That's a great question, Sarah, and I'm going to turn that one over to Jory to explain how the coordination of benefits works.
Hi. When we say that it's secondary to all insurance, that would mean anything that you're purchasing, paying a premium for, any type of insurance policy, because the AmeriCorps Health benefit is federally funded, it's going to be secondary. So if it's a covered benefit, it needs to go to your primary insurance. If it's a covered benefit and you still have like a deductible or a copay or out-of-pocket expense, then it's processed under the AmeriCorps Health benefit secondary. When we talk about it being primary to Medicare and Medicaid, it's just the opposite then. It needs to come to AmeriCorps first, and once it's processed, if it's a non-covered benefit, then it's submitted to Medicare or Medicaid.
Okay, and do we need to coordinate that, or is it done automatically? Do they?
Usually a provider will do that as long as you submit both cards and explain to them which one is primary and which one is secondary. But it is your responsibility to kind of monitor the process and make sure that the provider is doing what they need to do. But most of the time when you have dual coverage, they will take care of that for you, and as soon as they get a response from your primary insurance, if there's a balance, then they do send it on to us. But again, you need to monitor that. If you're getting a bill, you need to call them and ask them why and kind of ask them where they are in the process.
Okay, and then let's say that your copay with your primary insurance is more than your copay with the Seven Corners. Would you just end up paying the Seven Corners copay?
That's usually up to the provider, but I'd suggest that you ask. I mean, if you have, let's just say a random number of a $50 copay with your insurance and this one's only $5 for an office visit, I would ask them if they'd be willing to take the $5 copay under your AmeriCorps Health benefit, since they're going to be billing both of the insurance, both the insurance and this health benefit anyway. And some will agree to it. Others want your primary copay, but again, it's up to them. But most will agree to it if you ask them.
Okay, cool. Thank you.
You're welcome.
Thank you. Our next question is from Ryan Blanton. Ma'am, your line is open.
Hi, this is Ryan. I had a question regarding the tax credits, what exactly that meant and how you know, I guess, what the true value of the discount is.
Ryan, thanks for asking that question. I'm going to give that one to Dan, who has some experience with that.
Okay.
All right. Tax credits as well as tax subsidies are part of benefits that are offered through healthcare.gov and your state insurance marketplaces. And people are eligible for them based upon income. And the amount that you get is based upon how much income you have. It's on a sliding scale. So the less amount of money that you have for income, the more tax credits, the more tax subsidies that you will be granted. And then how it comes to you, how you find out what your amount would be, it comes through doing your whole application. Once you've gone through the application, you'll have an assessment, and it'll show you how much of the tax credits and tax subsidies you can take. And you can take any percentage of that you want for right away. You can take the amount at 100%, and then it'll help cover your premium costs throughout the year. Or you can take even 0%, and then when your taxes are due in 2015, then that comes as a credit on your 2015 taxes.
And Dan, as a clarifying question, you opted to take the subsidy up front, is that correct? Right. And that's helping to reduce your monthly cost on your premium.
Yeah, so for me personally, in taking the tax credits, the tax subsidies, I would have had a $240 bill every month, and that's how much my plan is worth on a month-to-month sort of a basis. But I decided to take all the credits and subsidies up front, and so I only pay $18 a month. One thing of note, there is a way that you can kind of guesstimate what your tax credits and tax subsidies will be, and that's if you use those calculators that I was talking about earlier. You can find them through healthcare.gov. You can find the Kaiser Family Foundation calculator through healthcare.gov or by going to kff.org, or you can go to getcoveredamerica.org, and they have a calculator there as well.
And both of those are listed on our resources sheet that is available in the file section underneath the webinar slides on your screen.
Thank you.
You're welcome. We're ready for our next call, operator.
Thank you. Our next question is from Carolyn Daniel. Ma'am, your line is open.
Hello.
Hi, Carolyn.
Good afternoon. Hi. Thank you for sharing the information that you've given us. I just have a quick question. I'm a senior citizen, and when I'm serving as a VISTA, I suspend Medicare to save $100 a month. Although since Seven Corners is not ACA compliant, do I need to get a supplement or reinstate my Medicare?
I just want to make sure I'm hearing your question properly. You have opted during your term of service to suspend your Medicaid, or Medicare rather.
Medicare,
and your question then is to avoid the individual responsibility payment, do you need to reinstate that Medicare?
Exactly.
And the answer is yes, you would need to do that.
The difficult thing is you can't reinstate it until you've had 8 months of a continual health care of some type. So since I've suspended it and I've just started back being a VISTA, then if I want to go back to Medicare, I can't right now. I won't be able to go back for a full 8 months until I have health care for full 8 months before you can go back once you suspend. Do you know how I can get around this?
At this point, I feel like this is a very specific question, and my recommendation would be for you to speak with a caseworker at the office that administers your Medicare benefit in your state. What you may have going for you is that it is still considered open season through healthcare.gov, and so by going through there, you may end up back in the queue and eligible for Medicare. But I would be hesitant to give you more specific information than that since it's such an individual issue. Dan has something quick to add to that.
Yeah, with that, because of your situation, you might be able to also file for an exemption, or if they don't grant an exemption right away, it may be an appeals process, and through that appeal, you might have some sort of arbitrated decision, which would be beneficial to you.
Okay. Thank you. Thank you very much. Okay.
You're welcome. Next question.
Thank you. Our next question is from Martha Johnson. Ma'am, your line is open.
Yes, thank you for this webinar. And my question is, if you have an emergency dental situation, do you need to go to a dentist that's in the network, or how do you find a dentist that will be qualified for this plan?
I'm going to send that one over to Jory to remind us where we can find our preferred provider list.
Actually, the preferred providers only is for medical providers. The AmeriCorps Health Benefit does not access the dental network since there isn't a true dental benefit, just the emergency services. So basically, you would just find any dentist that's in your area that would be willing to see you. And the only thing that would be covered then for the emergency dental is either an extraction, a root canal, or a filling. And as long as they note either by putting it on the claim or submitting the office notes along with the claim, then those three things could be covered. And of course the exam and an x-ray if they need to do that. But there isn't a dental network, so it would be anybody that would be in your area and willing to see you. And we do have a lot of dental providers call us and verify benefits, so they're welcome to call us for that.
Okay, thank you.
You're welcome.
Thank you.
All right,
Our next question is from Mike Angelo. Your line is open, sir.
Thank you. My question is, in the line of duty, how is that defined, and is there a standard form that we as a VISTA, in case we get injured or have some kind of illness in the line of duty? Is there any other paperwork for the supervisor to have to sign for?
Yep. So if you are injured or become ill in the line of duty, which means that you are actively serving at your site or under the direction of your supervisor, you've been told to serve off-site for some particular reason, and you're injured or made ill, that would qualify for a workers' compensation claim. And the information for filing a workers' compensation claim is in the VISTA member handbook on the VISTA campus under the section Workers' Compensation. There are two forms. I believe they are the CA1 and the CA2. And yes, both you, your supervisor, and your corporation state program office will need to fill those out and send them into VISTA headquarters. Your state program office would be able to assist you with getting that form to the right place.
Well, what if I have a catastrophic automobile accident or similar fatality? I'm not in any way, shape, or form able to sign or do the paperwork. Does this medical benefit allow next of kin to sign for me?
Yes. So in the event that you are in a state where you're not able to reach out to Seven Corners to get pre-certified for your emergency hospitalization, either a hospital official or, yes, a next of kin, even your VISTA sponsor could call Seven Corners on your behalf to make sure that you're getting the care that you need.
And Kim, could I just add something to his question about service-related injuries? While you're active as a VISTA, the claims for service-related injuries need to be sent to Seven Corners for processing. And like Kim was talking about the CA1 and the CA2, yes, those do need to be filled out with your state office, but the FECA or Department of Labor workers' compensation claim doesn't technically kick in and start covering until after you're no longer in the program. Seven Corners processes your service-related injury claims while you're active. So it's real important not to say to a hospital or a provider that it's work-related or workers' comp because that means something different to them than it does in this context. They'll send it to the state workers' comp office, and then it kind of gets lost because they won't process it on that level.
Well, thank you very much.
Thank you, Jory.
You're welcome.
Michael, does that answer your question? You understand the differences?
Yes, I do. Thank you for your time and your information.
Absolutely. Thank you. We're ready for our next question.
Okay, thank you. Our next question, it comes from Josh Bell. Sir, your line is open.
Hello.
Hi, Josh.
Hi. Mine's sort of more of an observation. I recently learned how much it costs my site to purchase health insurance, or sorry, not health insurance, but the health care coverage through Seven Corners. And this isn't to be bad on Seven Corners or anything, but the amount of money it costs to do that is more than the amount of money it costs for catastrophic coverage where I'm located. Right. I was wondering if you could give some observation on that.
What I can actually offer is a little bit more clarity. My guess is that perhaps your project administers not only an AmeriCorps VISTA project, but also has an AmeriCorps state or national grant. Is that true?
I am not 100% sure. I'm out in a satellite area away from the headquarters.
Okay. So likely your sponsoring organization is receiving essentially two programs from the corporation from National and Community Service. Okay. You're participating in the AmeriCorps VISTA program, for which your sponsor incurs no cost for your health benefit. Okay. We cover it all here from CNCS headquarters. For their AmeriCorps state or national program participants, they are responsible for purchasing some sort of coverage for those members. There are a couple of different vendors that are available to them, and it would be up to them to decide which benefit they want to offer to their members.
Okay. Out of curiosity, what is the average cost per VISTA member to be with Seven Corners?
Yep. The average cost per VISTA member actually fluctuates year to year depending on what sorts of coverage our VISTA members need. Just this year, we incurred tens of thousands of dollars in claims for one member who needed some extreme care. So that, of course, drove our overall average cost per member up, where in other years there may not be any catastrophic events and our average cost per member would go down. All of that information, our cost per member, what we pay for our health benefit, is available publicly on nationalservice.gov in our budget documents that are submitted to Congress and available for the public to view.
Thank you very much.
You're welcome.
And Kim, could I just add, I think, were you specifically, the caller was asking about a premium, or did Kim just answer your question? Because there is no premium paid. The claims are paid with the Corporation for National Community Services money.
Yep, I drew the distinction between the different funding streams. Thank you for your question, and we're ready for the next one.
Thank you. Our next question is from Ariane. Your line is open, ma'am.
Hi. So it's funny because I'm doing research as I'm sitting here listening to you guys, and my original question, and I don't know if it's because I'm simply ignorant in my research, is honestly, why aren't all VISTAs already exempt from having to do this? Because we are living at the poverty level on a stipend. Maybe it's because I just don't know enough, but I just know that we're already in our calculated range for the lowest possible amount of income, and how is it that we're still having to figure out if we can afford this or not? Because obviously we can't.
Yep. So you are raising a question and probably in the same state of mind I was about 5 months ago when I joined a work group to kind of go through our options. And it dawned on me a couple weekends ago when I was explaining the Affordable Care Act to my mother that VISTA participants are really just a slice of the overall American population in terms of income levels and the impact of the Affordable Care Act. And so within our VISTA population, we have a couple of different groups. There are some of you who qualify for reduced health insurance benefits through the marketplace, like Dan, who is able to get some tax subsidies to offset the cost of his silver plan. There's a significant portion of you who are eligible for Medicaid because your income is low and you are in a state that has expanded Medicaid. And then there's another slice of you whose, again, income is low, and in some states you would qualify for Medicaid, but in certain states you don't, because those states have chosen not to expand that benefit. And because of those three different dimensions, we found we struggled with what our VISTA members were left to do, and that's why we have decided to continue to offer our benefit as a safety net to ensure that everyone has some sort of coverage to cover really at least their basic needs and a little bit more during their year of service.
Okay, and my second question is kind of related to that. I'm finishing my VISTA service middle of this year in July. So the timing on things is kind of weird. If I were to find myself to be somehow exempt or, with magical Medicaid, and then I end my VISTA service, and I get another job, how do things change if, say, that job is to offer health insurance? Would I be able to cancel what I'm paying for through the government? I just don't understand how these plans are supposed to interact, and so I'm just confused.
Absolutely. So if you end your service in July and you find other employment right away, you would qualify for what Dan mentioned earlier, a qualifying life event, which means that you are able to either A, you would get insurance through your new employer, or B, you could go to the marketplace and get insurance outside of the typical open enrollment period. So if you end up on Medicaid during your VISTA year and then you find your other employment, you could get a new insurance plan because you have found other employment.
Okay, so what happens if the VISTA service ends and I was exempt while I was a VISTA, but now I'm not earning anything and I don't have a new job? Does that still qualify as a qualifying life event, and I can still get coverage without the back payment or whatever that I would have to do because I've missed my March 15th deadline of open enrollment? Or do I have to wait till November? How does that work?
Yeah. So at this time, ending your VISTA service in itself is not a qualifying life event. However, there are any number of other qualifying life events that you may be eligible for, like finding another job, moving, having a change of income, and a number of family and individual circumstances. At that point, you may also be eligible for an exemption. If in your research, you might want to start considering those next steps, and if you're unsure of what your situation may be in July, it would likely be advisable that you get some sort of compliant coverage now so that you have it during before open season ends on March 31st.
Okay. And I was a little confused, again, with those dates. You mentioned something about March 15th and then March 31st. So which is the date that we have to enroll by?
Yep. So March 31st is the very last day that you can apply for and receive coverage. March 15th is the final day to apply for and start paying for coverage if you want to be covered on April 1st. If you were to wait until March 31st to get your coverage, it wouldn't actually become active until May 1st.
Oh, okay. That's a difference.
Yeah, and those dates are fairly clear on healthcare.gov. Okay. If you want to look at those more closely.
And just out of curiosity, I don't know if I doubt I'll be a VISTA for another year, but I'm curious as to what AmeriCorps VISTA is planning to do as far as in the future providing coverage that meets the Affordable Care Act requirement. Because honestly, in my opinion, my very humble opinion, it makes sense to provide, for a government organization to provide health care to volunteers that actually meets the health care requirement. So I'm just curious as to what the plan is with that, or even if you guys know.
We don't have any final determination yet. What we are doing right now, as I alluded to earlier, is taking the time this year to kind of gather information and see how the Affordable Care Act continues to roll out. More specifically, we do have what in the government world is called a request for information out, which is really just a fact-finding mission. We put out a questionnaire to health insurance providers to seek their input on how much a compliant plan may cost us and what benefits would be offered to our members and what costs our members may incur as a result of changing our existing benefit. So that's where we are at this moment.
Interesting. Okay. Well, thank you. You've been helpful.
You're welcome. We have about 10 minutes left in this webinar presentation. We are going to take a couple of more questions, but I did just want to give everybody a heads up that we are nearing the end of this session. So we're ready for the next question.
Thank you. Our next question is from Tere Arage. Your line is open, ma'am.
Okay. Hi. How are you doing today?
Good.
Thank you so much. It's been quite informative. And I just had two questions. One is the mention about basically if you don't, if you do it in person, that you are not able to get the tax subsidy. That's the one question. It's probably for Dan. And then the second thing I wanted to know is, in order to get compliant, I understand that we have to do that by April 1st, but is there any way that when you're, completing your application that you can change the date so that it starts after your service period?
Both good questions. And the first one, Dan will answer, and it's drawing the distinction between getting coverage through a private broker and meeting with an in-person navigator for insurance through the marketplace. So Dan, go ahead.
Hello, Seti. So with the first question, if you meet with what's called an in-person assister, which is a navigator, a CAC, or an IPA, in that sort of a case, you're able to get the tax subsidies and tax credits and all of that, and nothing will change for you. However, if you are going outside of the health insurance marketplace and you're going to go to a state-specific agent or broker, which is how the system was set up before the ACA, in that case, then you will not be able to receive the tax credits or tax subsidies. The credits and subsidies only come through the healthcare.gov or your state health insurance marketplaces.
Is that clear for you? Do you understand that?
Not really, because you're saying state-specific broker and then health. So when it's state-specific, does that mean that's can you give me an example of a state-specific broker?
Yeah, so a broker or agent is basically going to be a person that works for a health insurance company as opposed to the health insurance marketplace, which is basically a place where all the health insurance companies come to offer their plans.
Oh, I see what you mean now. Now I got it.
And then your second question was, can you delay the start date of your health insurance?
That's right. And just get compliant. Mm-hmm.
Yeah, and that unfortunately is not an option.
Okay. Great.
I mean, you could wait until the last day, and then that would effectively, you'd have an extra month. But
no, I meant more like at the end. Let's say if my service ends at the end of August or what have you, to have the other insurance kick in by that time.
No, unfortunately not.
Okay, great. Thank you for your feedback. I appreciate it.
Next question.
Thank you. Our next question is from Atima. Your line is open.
Hello. Thank you again for hosting this. And my question was, my end of service is in March 1st, and I was deployed in South Dakota, which doesn't have a Medicaid expansion. But I had to change my residency to South Dakota because I got my driver's license here. But I plan on visiting friends on other states for a couple of months and then going back to New York where my parents live. So I was wondering, which state do I apply for? And I'm just so confused.
So Dan will give you some advice on that.
Okay, thank you.
Yeah, when you move back to New York, that'll be considered a qualifying life event. Basically, you move to another state, and at that point, you'll have that ability to apply for a new plan.
Okay, but in the meantime, that the months that I plan on visiting friends in like all through a few of the states, then I would be without insurance, or should I go
Correct.
to South Dakota?
Right, that would be correct, unless somehow you're considered a resident of New York at that point, but because you haven't moved to New York already, that won't be an option.
Oh,
but if you're to somehow move back to New York for a week and then visit friends, then there might be an option there.
Oh, okay. But I think I have to give up my residency because I got my driver's license in South Dakota.
Right.
Okay. And just one more question, because every time I look at the healthcare.gov, the income, which is like $11,000, it falls below whatever assistance we can get. Is that because it says that the income is too low for subsidies?
Yeah.
So you're saying you're making less than the $11,000 that's listed on healthcare.gov?
The VISTA, the stipend is like around $11,000, and when I put that in, it says that it's too low for subsidies. I have to go up to $12,000 to get any.
Correct. So your options would then be Medicaid, or if Medicaid is not expanding in your state, you would automatically qualify for an exemption and not need to get ACA compliant care and could just continue serving with our AmeriCorps health benefit through Seven Corners.
Okay, thank you so much.
You're welcome. We will take another question.
Thank you. Our next question is from Tara Gay. Your line is open.
Hi, I just had a quick question regarding the Medicaid. If you are in a state that has declined any of those benefits for their residents, what are the other alternatives that we might have for seeking support?
In terms of health coverage?
Yes, I'm sorry.
Okay.
Yeah, in that case, you can have an exemption for healthcare.gov, and then you don't have to pay the tax. And then after that point, you can go to healthcare.gov and get your own plan. You can go, but it will not have the tax subsidies or credits. You could also go to an agent or broker, and there again, you would not have the ability to have the credits or subsidies as well. So if you want to have coverage beyond the VISTA benefit, those would be the options if your state is not expanding Medicaid.
Thank you.
All right. We are going to take one final question. Before we take that question, I do want to invite everyone to take a few moments to share your feedback with us on how we can improve these sessions. So a survey or evaluation has popped up on the left-hand side of your screen. We'd love for you to take that. And also, for those of you who were not able to ask your question or get your question answered, please remember you can call Seven Corners at any time if you have questions about your AmeriCorps health benefit, or go to healthcare.gov for questions about the Affordable Care Act. And as a reminder, all of the resources that we mentioned during this presentation are currently available in the file section and will also be emailed to you and uploaded to the VISTA campus following this session. So, operator, we'll take one final question at this time.
Thank you, and that question will come from Sam Johnson. Sir, your line is open.
Hi, my question is, when we are estimating our annual gross income on healthcare.gov, do we need to include any end-of-service benefits we get? Like, for example, I'm taking the education award. Do I need to include that on my gross income estimation?
No, you do not need to include your education award or end-of-service benefit when estimating your total gross income. Good question.
Okay. Then I guess a follow-up question would be, can I include, because I also live in a state that hasn't expanded Medicaid, and if I include that education award, then it puts me at the level where I'll be able to receive the premium tax credit. So is it possible for me to include that at all?
I don't know, and that would be more of a tax expert question. Your education award is not actually taxed until you use it, so it would really depend on when you plan to use that education award, and you'd have to think about your income in that particular tax year.
So it would depend on if I use it as soon as I get it or not.
Again, I would be really hesitant to answer that. I'm not a tax expert, and the best person to talk to about your taxable income would be a tax expert.
Okay, thank you.
You're welcome. I want to thank you all for joining us today and for putting up with the lack of chat feature. We know that you all love to interact with each other that way during these sessions, but we did find it to be really important that you give your full attention to this critical matter and important matter. So thank you for your attention and for joining us. We invite you to attend our Making Better Decisions webinar on Wednesday, February 26th at 2 p.m. We look forward to seeing you then. Thank you.
Thank you for participating in today's conference. That does conclude this call. Please disconnect your lines and speakers stand by for post-conference.